Hello, everyone. I'm Rebecca Emerson, the Executive Director of Exceptional Families of the Military, and I'd like to welcome everybody to our Facebook Live today with AFI's Military Spouse of the Year winners. The point of this Facebook Live is for families to share their experiences with EFMP with the military spouse winners. Sharing our experiences will help arm the MSOY branch winners and base winners and various advocacy platforms with an inside look into EFMP challenges that they can use to hopefully help voice our concerns in places that we may not be. I just want to explain briefly, Exceptional Families of the Military is a nonprofit, 501c3 nonprofit. We're an all-volunteer force, and we're EFMP families ourselves. We help people through support groups. We also have case management where we directly help people with compassionate reassignments and things like that. And we also do advocacy with the government and legislators on behalf of EFMP families. I'm also going to briefly explain the EFMP program. So some of you watching may not understand what it is. I'm talking about DoD's EFMP program. Which includes all the branches. There are three sides to it. There's a medical side, a family services side. So think Fleet and Family, Family Readiness Center, ACS, those types of things. And then there's also a third side, the programmatic rules from the Office of Special Needs. And then each service branch for EFMP. So there could be, when people say EFMP, they could mean any or all of those things, and they may not be directly related to each other as well. I also want to explain a little bit about Military Spouse of the Year. We do have, they have nominations open right now, and if you're interested in nominating a spouse for this wonderful program, please do so. If we could drop that banner in, I have the MSOY website, and also nominations are due by the 27th of January. So you still have plenty of time in case there's that spouse that is really making a difference that you want to nominate. I want to, before we go into introductions, I also want to mention that Carolyn Chase, who is supposed to join us today, had to deal with her daughter. I don't know how else to say it. Sometimes we have things that pop up when you're EFMP families, which she is, and they happen at the last minute, and this is our lives. So I just want to say we can still answer any Garden Reserve questions that may come up, and she can also get back with you one-on-one if you wanted to talk to her later. So I will kick it over for introductions, and I'll just ask that everybody briefly introduces themselves, say whatever you want to say about yourself. I will start off with Heather, and if we could end with Sergio, because he kind of has the first part of our discussion.
Hi, thank you. Good morning, everybody. I guess maybe it's only morning here for those of us in dark interior Alaska. The rest of you are probably somewhere in your midday or your evening, like you, Hiva. My name's Heather Campbell. I am the MSOY winner for Eielson Air Force Base, which is up here near the Arctic Circle. I am an Air Force spouse and mom of three. And I had learned a term called accidental advocate, and I really love it. And I think that's how I would describe my work in food insecurity in the military community. As a young military family, we struggled to figure out how to make all the dollars stretch in the right places. And it really opened my eyes to this community. And also, I'm a registered dietitian by trade and trained in pediatric nutrition. So I've worked for WIC for a number of states. So this was sort of my professional wheelhouse already. And then I walked through a season of food insecurity, and that snowballed into accidental advocacy. So thank you for having me here for this conversation today.
Thank you. Hiva, if you could go next.
Sure. So, first of all, thanks for having me. Really eager to have more of a discussion and conversation and to hear some of the feedback from anyone who might be watching or just members of our community in general. My name is Hiba Abdul, and I'm the 2022 AFI Air Force Spouse of the Year. So, really proud to represent the U.S. Air Force this year. It's been a lot of fun, but has also really opened up, my eyes to some of the different challenges and different issues that our military families care about. I am currently in Germany, so we are Oconus, and which is why Heather mentioned that it's evening time because it's about 6 p.m. here. But yeah, this is definitely in the context in the course of my advocacy, my personal advocacy, and my advocacy in this role as the Air Force branch representative and winner. I obviously care a great deal about the quality of life issues that affect our military families, and EFMP and the EFMP program are certainly a big piece of that. So thanks again for the conversation, and really looking forward to hearing some of the feedback and discussion today.
Thank you. And Sergio, you're next. If you could please introduce yourself.
Good morning, everybody. My name is Sergio Rodriguez. I am the 2022 Armed Forces Insurance Navy Spouse of the Year. And as Hiba mentioned, we have gotten the opportunity to, experience and hear from so many people about what is going on out there. So it is an absolute pleasure to be here today with you guys. Thank you, Rebecca. Thank you, everybody, for inviting us and having us here today, because I am ready to have this conversation. And hopefully we can, do whatever we can to make some changes to propel forward. So let's do this.
Okay, great. So we did ask for some questions ahead of time via a Google form, and I'm going to pop in one of the adult question that we had in there right now. Of course, those listening in right now, you're free to ask questions at any time, and we can pop those on the screen as well. But one of the things that happens, or one of the things we hear about from our families and our support groups, is the adult EFMP perspective. And that's what I want to talk about first. And if we could pop that banner up. Let's see. We did have a kind of a comment or a question about respite care here. So the comment is no respite care so that we can go to our appointments and treatments. It's especially hurtful to me personally because I see so much fraud with respite for pediatric EFMP and no adult help. So Sergio, do you have any comments on adult on this topic?
So as far as a EFM adult, it's definitely a lacking space that we have as far as the military across the board. I can tell you personally, as being a disabled spouse, the EFM program, I can sign up for it. I'm not part of it. I'm not explaining to you guys why in a little bit, but part of this is my struggles is like myself. We signed our daughter up for childcare here in Monterey. It's an Army base, but there is no parameters. There's no specifics for a spouse, an active duty spouse with a disabled spouse. So if you're a disabled spouse and you're married to an active duty spouse, there's no category for you on the list. So if you want childcare, you're literally at the bottom of the list, and anybody can then push you off that list, which you would think to yourself, like, if you have a spouse that's disabled and you are an active duty member, you might want to be able to give that spouse a break and let them have, some childcare. I've spoken to spouses that, sit there and struggle because they have mobility issues, they have other issues, and they can't even get into the programs that are designed to help with their kids because they're at the bottom of the list, which I'm not even sure how. And I've been, pushing that agenda and letting folks know that I'm not happy about it. And I don't understand why we don't have it. I mean, it starts off with wounded warriors, then it goes on to spouse with a working spouse, and then spouse with school and so forth. And it's just, but there's nothing for your disabled adults.
I'd like to add too that there is a standardization effort going on with respite right now, and we did provide feedback on that to the Office of Special Needs. We did talk to them about or provided feedback for adult issues, and we don't know what it's going to say because it's not out yet. But they did inform us that they are working on it and they are aware of the issues. So we hope that there'll be some sort of provision in there in regards to adult respite care, and provisions as well for oversight for the program to address the fraud comment in this comment. I'm sorry, Austin, did you have something to add?
Yes, so for everybody listening, we are talking about your community service respite care, not ECHO respite care. And I think it's important that we point this out because we had an adult family member recently, the spouse, which is the service member, reached out and they're unable to access ECHO respite care for their wife who is significantly disabled post-accident. And that is a topic that we are looking into. We know that's an issue for all EFMP families, is accessing home health care. This family brought to our attention specifically as an adult spouse in EFMP that they were told they needed another adult in the home to access respite care through ECHO, even though the spouse is an adult herself. So if you are having issues like that, please reach out to us because we need to be able to take your voices collectively to Congress to really explain the issue. So it's a little bit off topic, but it does apply because there are instances where we know there's going to be a reason that an adult spouse is going to need in-home nursing care or respite care, depending on the number of hours.
And I'd like to just back up and explain a few things to everybody, just for your knowledge base for respite. Is there's two types of respite care that EFMP families can apply for. There's the ECHO respite care, which is through TRICARE, right, which is under DHA. And that respite care and the ECHO program in general is not accessible to all EFMP families. So you only qualify for that respite care if you qualify for TRICARE ECHO. And not everybody qualifies for TRICARE ECHO. It's 16 hours a month. There was NDA language that increased it to 32 hours per month, but DHA has informed us it'll take about 3 years to update the policy manual. So there are some issues there because it's hard to find. Another barrier is finding providers who are willing to only work 16 hours a month. That's not very many hours a month. Also, there's branch of service respite care, and that's the respite care that I talked about being standardized across the services. And right now it is very, very varied across the services. Some services have 40 hours a week and you can have sibling care. Some services are 40 hours a month. And some services are 25 hours a month and don't have sibling care and everything in between. So those are the differences, but there are onboarding issues with respite care providers on the services side too. And I'll just give you a quick example of that. Is I was in DC, which is a large metropolitan area, as everyone knows, and it took me over a year to get my respite care provider onboarded. And we got about 3 months of respite care before we PCS'd again, because I also had to source her myself. And that was through branch respite. So that just gives some insight on that issue. And I want to open it up now if Sergio, you have any more comments you would like to make on adult EFMP as an issue, or if there's any other questions regarding this section of EFMP.
No, I don't have anything else further on that. It's just it's just mind-boggling. You said 3 years for implementation. It's like, what if we know that it's needed? Why are we waiting 3 years? This is just I just don't get it. I'm sitting here. I'm sorry.
Yes, I don't get it either. So the other question we asked, and this is really just for everybody's, just knowledge bases. We asked, hey, what are some of your biggest barriers with EFMP? And we got some themes amongst those, the first one being PCS or assignment issues. And we would like to share some of the comments with you right now. So this is one of the questions that we got. Could there be a way to designate EFMP families based on severity of their needs, state waivers, and have that support a service member's case to stay in the current state or location if desired? So I would say that this is a pretty common issue amongst our population, and I just want to explain what state waivers are. It's a Medicaid waiver essentially to provide additional support, and it varies from state to state. You could be in a state with no wait list. You could be in a state with a 10-year wait list. So like, let's say you are in North Carolina, which has a 10-year wait list, and you finally pop up on that wait list. Let's say you've been there for 10 years, and then you PCS, you start the process all over again at your new state. So this person is asking for flexibility, essentially. And then we have another comment here where assignments have gotten restrictive, putting our EFMP families at a disadvantage for jobs/promotions. When I have found care, I'm still denied. There needs to be a better appeals process. So that is a common theme amongst all the services, actually, and having a way to provide input into the assignment process. And here's another assignment one. We don't have communication with decision makers regarding duty stations. Another one where they don't know why they've been denied, but they've been denied and then can't seek help from their local office. And then this is also one that touches a lot of different areas, but the service member is voluntold to geobatch overseas when the EFMP child/spouse cannot go. This can tear the family apart, essentially. So this person is most likely Navy, since they're using the categories, and the Navy does have categories for EFMP families. But a lot of our families are forced with this decision in order for them to continue serving.
So, I mean, can we pause here? I feel like we've tossed a lot of comments out there to you guys over the last couple of things that our families have shared with you. Do you guys have any input you'd like to give? Please don't feel pressured. We know this is a tangled mess, but it's a lot. So do you guys have any thoughts on any of the topics up to this point?
I just have like a couple of things that I want to add, like broadly, more general than specific to to any of the individual issues that have been raised. But something that I'm really broadly hearing is that there's obviously trends, right, in the different areas where there are challenges and issues. So if it's respite, if it's access to childcare, like Sergio mentioned, right, because there's not that recognition that, oh, the EFMP family member could actually be the spouse as opposed to maybe the child. All of those things are, and again, when you look at them across the comments here, or some of these questions, they to me show a trend in those issues and in those areas. And I know I didn't share this in my my introduction, but I did spend about 9 years working as a legislative staffer, a congressional staffer on Capitol Hill. And part of my issue portfolio was working on DOD and VA policy issues. And so worked a lot on the VA healthcare space, and also, TRICARE, so military health generally. And it's really important, and I just cannot stress this enough, that when the department does offer opportunities for families to express these concerns, especially because this is a Department of Defense led program and it's executed right by each of the different services to the Department of Defense standard or level, but they are who DoD is, who has jurisdiction over the execution of the program, and right will undertake some of the policy or programmatic changes that we're all talking about here. They're the ones who consider them alongside the Office of Special Needs. Cannot stress enough the importance of EFMP families participating when given an opportunity in surveys, requests for information, engaging right with organizations like EFM, obviously, to share those experiences as they're happening. But please do not miss out on those opportunities to communicate these challenges, whether it's regards to respite care, the acknowledgement or recognition that there are adult EFMP needs, or something like, obviously, these issues, again, regarding assignments. This is critically important. I cannot think of a situation or a scenario where policies, programs, and initiatives have been successful when they're not informed by the community that's impacted. And this is a very real and very specific instance of that. So please do not miss out on those opportunities to engage. Seek out those opportunities to engage if they're not currently active. So if there's not an ongoing survey situation, go ahead and reach out again to whichever organization it is, if it's EFM or another organization that's working on that issue that you might care about. And be sure to communicate these challenges, because we really won't be able to make any kind of meaningful or significant changes or progress if we don't have those communications. On the backside of that, when it comes to implementation, and Sergio mentioned it, and I couldn't agree more, having worked on a handful of these types of issues, 3 years to implement a timeline designation for something that already exists seems curious. And that would be a really great question to follow up if you're, having a conversation, or if you're advocating with your congressional or your elected officials. Why? Why does it take Defense Health Agency 3 years to implement the expansion of hours eligibility for a program that already exists? We're not standing up something from new. So ask questions and be sure to share those experiences, because they really do matter, and they help shape and inform the policies, programs, and initiatives that impact the EFM community. So just wanted to share that. Sorry, I know it was long-winded.
To go off of what Hiva just said as well, you guys, I can tell you myself as an advocate, when it comes to reaching out to those officials, when it comes to reaching out to these organizations, don't stop at 1 try. Don't stop at 2 tries. If you're not hearing the answers that you need and you're not getting the assistance, keep making phone calls, keep sending emails, keep reaching out. Like Hiva just said, it takes work. And the more you contribute, and if you could find others that are having similar issues as well, the better chances we have in implementing changes. Just continue. Don't give up at the first sight of, somebody ignoring you or saying no. There's other people. So please push.
Definitely, it's definitely a long game. And thank you for saying that, because I know that a lot of our family members and our groups have expressed frustration. So when opportunities do come up, and I'll just mention the latest DoD survey that came out, people, have commented that they want to know what's going to change as a result of the survey, right? And, when they've been promised change before and it takes so long, but it really does take a long time. And I do agree that it's important to provide that feedback. Especially, we are hopeful that this survey that DoD put out on EFMP will continue every year or every other year at least, because this is the first time they've done something like this. They haven't even asked our population before on how they're feeling. So as imperfect as it may be, and we may have wanted different questions in there, I'm pretty excited to see the data, which they did say they would publicly release. So I'm excited for that. But there are some of the other issues, and I can just, say, like, in summary, when it came to the biggest barriers, it was definitely assignments, and we did mention a lot of the assignment comments in there, and that seemed to be the big rub point, as well as medical issues with wait times, as well as medical issues with gaps in coverage. So, which brings us to expenses. And the next topic of discussion is how expensive it is basically to be an EFMP family member. And we have a food insecurity expert with us, Heather. Hi, Heather. And so this is one of the comments. For us at one point in time, we were paying about $300 out of pocket for multiple family members' copays, and having to purchase medications that TRICARE didn't cover. So this is something that may not be known to very many people, that because, before I had a special needs child, I had no idea there were any gaps in TRICARE coverage, honestly. I had everything that I could possibly want covered, and it never occurred to me that there were any gaps. So, Austin, I'm going to put you on the spot if you want to talk about some of those gaps, or we can show the other comment too. It's fine.
So I felt like they went together, which is why we pulled this one up next, Rebecca. Is this one is saying they know many family members who've had to pay $1,000 out of pocket for medications they can't get covered, or because of high copays, high grocery bills for specialty diets. And that is, I feel like this all pulls together, right? There are so many aspects that apply to this. So Heather, one portion of this is definitely right in your wheelhouse. We have families who are on specialized diets for celiac disease and other medical conditions. And what we have found, speaking with families, is that the programs that are out there to fight food insecurity that don't involve monetary compensation of some form, right? Not a gift card to the commissary. They don't think about families with these special dietary needs. So the food bags from the commissary. So can you talk to us a little bit about what you've seen in this realm?
Yes, I can. It's one of the difficult things about food insecurity is its complexity, and that it doesn't look the same across different families, or even in the same family in different seasons. And part of that is because there's so many different causes. It could be financial. It could be related to a diet. There's all these different ways that families get into either sort of a short season or more chronic season of really struggling to make those dollars work. And in my background as a pediatric dietitian, I worked in pediatric pulmonary. Specifically, my research was in cystic fibrosis. So for those of you who know anything about that, that is a lifelong disease. I was researching on like molecular level nutrition, really nerdy stuff. And then I met this guy in the military, and I have not been able to continue that work as a military spouse because the Air Force has not sent us places that have that work for me. But what I saw in that population was that we have these patients, these pediatric patients in that situation, who have these special diets, who have extra specialist appointments, who may have gaps in their insurance. I did see TRICARE, may have gaps in what Medicaid or Medicare were covering for them. And then I moved into the military spouse space, and I saw it exacerbated, where we may have one income families. A lot of the time you have one parent who's a primary caregiver, so we're not getting secondary insurance. TRICARE has cut back a lot of what they're covering. There are co-pays. We get sent to difficult locations. We weren't even a difficult location for myself. We were in Montgomery, and I had a heart surgery. It was minor. It was a minor. I had a heart surgery, and TRICARE didn't reimburse the travel because it wasn't 90 miles away. It was 87 miles away in Birmingham. So these are these small loopholes, right, which really create barriers for families. And because it wasn't reimbursable travel, we also could not get childcare reimbursed for my 6, 5, and 2-year-old. So I had to then I had to coordinate, neighbors or family or someone to come in, make sure my husband could get time to take me to this appointment to get this surgery. So this is just one situation that I had, or some of the glimpses that I've had in this population, but this is ever present for our EFMP families. This is something that is ongoing. And just like we said, it starts over at each location. And one of the tricky parts specifically with food is assistance. We have something, this Supplemental Nutrition Assistance Program, previously known as food stamps, is SNAP benefits. Well, that uses housing allowance in its calculation. So if you get civilian housing allowance, like Section 8 housing, that does not count. But if you get military housing allowance, it does count. But we all know that BAH doesn't even cover the full amount of your housing costs. It's definitely not available for food money. So we have this gap where we can't qualify for food stamps. There's another program, Supplemental Nutrition Assistance Program for Women, Infants, and Children, also known as WIC. That's for pregnant women, postpartum women, breastfeeding women, and children up to age 5. Well, that cuts off when you're 5, even if you're not yet in school. And that doesn't help if you have a 6, 7, and 10-year-old, then what? Who's there to help those families? So there's gaps that exist in their programming already. And then military families don't have a lot of places to turn. We don't have anywhere necessarily within the military that can help. We're sent to food stamps, or we're sent to WIC. Well, okay, we don't qualify for those. Oh, you can go to your local, on-base installation. They can teach you about budgeting. Well, budgeting only goes so far if there's not enough dollars to go around, or if we're paying for special diets, or if we're paying for special foods, if we can even get them at our local commissary. That's great. There might be discounted, but likely we're going to specialty food stores. We're going to local grocers to get those special food items. And all of that cost really adds up. And the only financial help is maybe a grant, but oftentimes, a no interest loan where you can borrow from your future to pay for your present. So there's a lot of difficulties that make this an ongoing conversation for our EFMP families.
And Hiva, I know you're overseas. Can you speak to us about food costs and the reality of some of this overseas for families that are sent to Oconus?
Yeah, thanks, Austin, for that question. It has been really challenging. If you all can obviously, imagine, not just with the current issue happening here in Europe, but obviously some of the supply chain issues, right? So our Oconus locations, Japan included, Korea, we have a lot of families that rely and depend on the Department of Defense, solely and singularly for access to some of the items and materials and grocery items and materials, right, that they would need. And so it does make it really, really difficult, especially when you see those cost fluctuations as a result of either, again, supply chain issues, or as a result, unfortunately, of the current geopolitical issues that are ongoing. And so this situation has become really, really, really challenging. We do receive an Oconus COLA. That's of course decided, by each of the lead organizations or agencies or services, depending on your location. And it's also subject to inflationary rates. So the rates of inflation sometimes, right, because the US dollar was experiencing a high rate of inflation over the last, almost year. The way that was being reflected in the COLA is that the US dollar is stronger, which isn't necessarily the case, but failed to take into account the fact that things were becoming more so increasingly expensive here in Germany. For Germany specifically, I can say that we are really fortunate to have access to a tax-free benefit for gas, for example. It's rationed still here in Germany. And so military members that are on a vehicle registration are able to access those, car fuel at that reduced rate. Again, zero taxes. However, on the economy, right, outside of the installation gates, gas in Germany is still over $7 a gallon. And that's for the very basic, unleaded fuel. So that's the most basic rate of fuel, over $7 a gallon. And you have to imagine that all of the supply chain, contributors, including, the trucks that haul, right, grocery items from warehouses to and from grocery stores, that supply, they have to assume all of that cost. And then as can be expected, that cost is then passed on down to the consumer. And so that means we've seen, double-digit increases to grocery items, and it's a lot of stress for our families. The overseas COLA was reduced by double digits here in Germany for the largest military community abroad. That's something that, our leadership, our installation leadership at Ramstein Air Base has really been fighting against, to ensure that the Department of Defense is aware of what these increases in costs, the impacts that they've had on our families. And not everyone can live on base, so most of us live off base, have rental agreements, but that means our utilities costs have also gone up. So I would just say, for all of these challenges that we see at home, we see them abroad as well, and they've manifested themselves in sometimes greater or just in very different ways. And I really appreciate that, Austin, because we have seen, and German news agencies report on that the cost of a gallon of milk, the cost of some grocery stores to even operate, because of the utilities issue, because of Ukraine and the ongoing situation there. Some of the smaller grocery store chains have had to close. So anticipating those needs, right? That reliance, even if you live off base, even if you regularly visit, grocery stores on the economy, they too are experiencing supply chain issues that need to be addressed, and can be incredibly challenging for military families, especially when you're living overseas. So I would just encourage everyone to also keep that in mind when we're talking about some of the financial constraints and financial challenges that families can face abroad, whether it's with regards to accessing healthcare services or things as necessary as groceries. Thanks again.
So if I could circle us back to where Rebecca asked me to step in, which was a few minutes ago, we were talking about prescription copays and medical copays. And by and far, we've seen that there's been a large change in the pharmacy benefit in this last year. I know we talked about pharmacies being dropped from TRICARE, those smaller pharmacies, the ones responsible for compound pharmacies. But one of the things that is often overlooked in our population are those families who are assigned to remote locations, recruiting duty, etc., that don't have an MTF nearby, so they can't get their medications from the MTF for free. So then they do have to pay their copays. And I know we were in Boston for my little girl, and we couldn't go to the MTF because she had been in the hospital. And our copays were over $700 a month just for her medications. That didn't include anybody else in our family. So I know that we have multiple families who have more than one EFMP member enrolled. And you can imagine that this goes across, all aspects of life, trying to figure out, how am I going to get medications? How am I going to make sure that I can pay the garage parking fee at the hospital that we have to go to? And so when we add all of those things together, it really does become that perfect storm that Heather was talking about, right? Which is, you could do this once, you can take a loan once to help you where you are now. But our families find that this is a cycle that they can't really get out of. And there aren't programs to really help us, because the majority of the programs are for wounded service members, which obviously we all appreciate. And those are very important programs, but they're not made for family members that are disabled. And then our civilian counterparts think that the military saves us and that everything is great and TRICARE is 100% free and we live a very, very joyous, well cared for life. And that hasn't always been the case for a lot of our families. So I guess, do you have advice for families? What do they do going forward, right? I know, Heba, you had said talk to, legislators or services, but is there something else that maybe we haven't thought to tell them that they can be doing to really make this issue become much more apparent to leadership?
I think documentation is really important. And I know that in the realm of, having to also document for the parent stress assessments and, the a whole other host of, medical issues. I know that is really challenging, but I think there is really something, there's something to be said about how leaders, whether, at the department or on Capitol Hill, how they receive that information and how you make that case. And so, it's obvious and evident, right? They make a lot of decisions. They wait for data. They wait for numbers. They wait for information. So show them that data, that you don't need to wait for a survey to know that, every single month it costs my family this expense because of a decision or a policy change or a program change implemented by the department with next to little or no, preparation. And include all, I would just encourage folks, like, if you haven't done that and really sat down and spent some time with it, I think that can really make your story and make the challenges that you share, make those conversations and engagements that much more powerful. And it's to say, look, not every family has the same experience, but we can tell you this is the impact that this experience had on me. And that's why it's important. If there's an EFMP family where you have a spouse, right, who is a caregiver 100% of the time, they don't have any access to respite care, they have no access to childcare or unaffordable access to childcare. The spouse obviously can't work due to the caregiving needs of the EFMP family member, et cetera, et cetera, et cetera. There is an expense to that. If you are dependent on a single income, you need to communicate that information and why. It's really, really critical. These things don't happen in silos. They impact that same family. And so I know that it's frustrating, but please, if you haven't spent some time putting that information down to, pen and paper or, just typing it out in a quick Word doc and updating it, right? Please do that. Please do that because it is critically important. And I think, Rebecca, you said it wonderfully earlier. There's a lot to be said about the fact that at least the Department of Defense is asking questions. They may not be the right questions or the ones that we think are the most reflective of the issue, but it's a start. It is a start. Do not give up and just document everything. That, in my mind, is really, really important. I hope that answered the question that Austin shared.
Yes, thank you so much. And speaking of data, I would like to preview our own survey, which it was small, very small compared to what the DoD can do, but hopefully this might compel them to ask some food insecurity questions of the EFMP population and the next survey. But our internal survey, which is about to be released, 17% of respondents stated that their family has faced food insecurity in the past year. And these are only EFMP families. And for those who responded, a large portion of them stated that their EFMP related costs contribute to their food insecurity. So, those were some of our findings. We also found out that 45% of the people that said yes stated their extra medical expenses purchased contributed to their food insecurity. So we do have a little bit of data behind this, and we're excited to share this when we talk about this subject, and we will be publishing this so anybody can use it to share for any of these discussions that you might have. But a lot of the comments that we received were pretty heart-wrenching, honestly, and the majority part of our survey was qualitative data with personal stories. So it can get pretty heavy and meaty to read through. But those are some of the easy numbers on the topic.
Can I chime in quick on food insecurity? So there is another nonprofit which has been doing research in this space since 2017, the Military Family Advisory Network. And they are research and data giants, which I love because, to Heba's point, data speaks, right? We need those numbers to be able to say, hey, this isn't an isolated incident. This isn't one person falling through the cracks. This is what we're seeing. And their data led the DoD to look into food insecurity. And, it's kind of one of those, well, this isn't a thing. This isn't a thing. This isn't a thing. Okay, maybe it's a thing. We'll look. Just settle down, Linda. We'll look, right? So then DoD looked. Their data was delayed coming out. I know everyone in the military community is shocked, but it finally came out, and it was 1 in 4 families is what the Department of Defense said. Hey, 1 in 4 of our military families are struggling to reliably put adequate food on the table. And at the same time, MFAN released new data. They did qualitative data as well. And they looked in Texas and they looked in the Hampton Roads area. They did 2 different studies and said, why is this happening? We know this is happening in our community. What is going on? And they had 4 main causal factors of these same themes that type in, your answer that military families were saying, this is why food is difficult. This is why we get in trouble. One is loss of spousal employment. So, you go to one income, spouse can't get a job, you move, whatever. Another is adding a new family member. So whether you're adding an adult, you're getting married, you're adding a child to the family, you're blending your family, but adding another mouth to feed. Another one is PCS. We know on average, it costs thousands of dollars per PCS of unreimbursed expenses. And the fourth one, which is what I wanted to bring up, is an unexpected financial expense. Well, financial expense, obviously, but an unexpected expense, something that is going to put stress on your family, because as we're PCSing on repeat, as we're struggling to get childcare, as we're struggling to get spouse employment, we don't have a backup plan. We don't have this safety net in our finances. And so one big thing, like buying 4 tires in the middle of a PCS, that was a thing for us. That can wipe that out really quickly. But what we're seeing with our EFMP families, they are living this narrative on repeat. They are constantly, chronically having hundreds or thousands of dollars per month of unreimbursed expenses, of expenses that aren't being covered by the services that we are supposed to be covered, and they don't have anywhere else to turn. So this is a really important thing to include when you're sharing that data about the EFMP population that you received on food insecurity, to say, hey, this data that we found matches exactly with what MFAN also found. An unexpected expense is causing stress for our families. The only difference is EFMP families are seeing it on repeat.
Thank you so much, Heather. And this has been a great discussion. We do have a couple of comments from the live that I'd like to pop in. One that does relate to this last topic is childcare. And it can be very expensive for us to find childcare. As another unexpected expense, I know from personal experience, from giving birth to a child with Down syndrome, all of a sudden, a lot of doors were closed to me for childcare that were affordable. And so this comment here, she said, thank you for having this discussion. I'd like to talk about CDC on base not being fully equipped to serve EFMP families. For there to be so many EFMP families, which there's 146,000 across DoD. For those who didn't know, I feel like there should be more resources on base for childcare for our families. And I completely agree with that statement. And in the latest SecDef memo, when it talked about expanding childcare, I was disappointed to see that there wasn't options listed for EFMP families. And to Sergio's earlier point, I don't know if this viewer was here to see that, also categories to help adults with disabilities.
Well, I could even chime in on this one. I have a friend that was looking for some assistance with her child that is on the spectrum, and reached out to the CDC and asked them, hey, can I get my child signed up for some services? And her response, and I called to assist her with the CDC, was, we're sorry, but we're not equipped to deal with any kid that's on the spectrum at this base. And so what they told me is, if the kid runs and doesn't listen, they're going to call the parent and have them come home. If the child soils themselves, they're going to have the parent come pick them up. If the child throws a tantrum and does not want to, respond well, they're going to call the parent to come pick them up. So all of these different, we're going to call you to come pick up your child, doesn't help the parent. And when you have a child on the spectrum, and I mean, what baffles me is there are plenty within our community when it comes to military spouses. Why? I mean, I was shocked at the CDC's response when I was trying to help my friend with this, and I didn't stop there. I took her experience all the way to the top. I mean, I took it to those that make decisions and let them know that this is what my friend was experiencing. This is what this spouse, and this is what I heard from the CDC. It shouldn't be the answer. Like we should be better than this when it comes to taking care of our families. I'm still at a loss for words for the responses that the supervisor over at that CDC told me.
Yes, I think it goes to, we get the answer a lot that there is a process for our family members to be accepted in the CDC, but to an earlier point, there's a lot of barriers to actually accessing it. So leadership will point us to the process, and then you hit these roadblocks when you actually call, as you pointed out, Sergio. And, you know, when statistics are being released on how many EFMP families are in the CDCs, what diagnoses are they covering? Are they covering any medically complex children or children with medical needs or feeding tubes or things like that? Are they covering developmental disabilities? What exactly are they covering? Or are they covering, peanut allergies and asthma, which are very serious as well? But what we're looking is for coverage within the whole spectrum of EFMP for essentially subsidized on-base childcare to help us with our expenses. So we do have another question from earlier that I'm going to pop up in here, or a comment. And I'm not sure if this was already asked, but can you go over the reassignment process and what qualifies a family to be considered? We are struggling to find therapy close to our town for one of our kiddos and have to drive 2 hours away 2 to 4 times a month for it. And we're not sure if that's enough for us to be considered. So I'm going to kick this one over to Austin to address.
So there are a couple of types of reassignment processes. I'm going to assume that this reassignment process is a compassionate or a humanitarian reassignment. And that can differ based off of your location and your chain of command, and also your sponsor's rank and what their current job is. It shouldn't be that way, but that's how it is. So the short story is it's more about mileage than it is about drive time. If you're in a large metropolitan area and you're driving 2 hours, that may not meet the mileage requirements of that over 100 miles that's required for TRICARE Prime travel. And that may be part of the reason why you are being given odd answers to the reassignment process. The other piece to this is if you're struggling to find therapy close to the town, I would go back to EFMP Medical and tell them that you can't find this therapy. Tell them that you've gone down the wait list, ask for a case manager at ECHO, because you're going to need proof that this is indeed not available and there are wait lists. But this is something under almost every branch's regulation that you can use to ask for a reassignment. Be prepared when you ask for that reassignment. Know where you want to go. Make sure that unless this is a very specific, unique need, that it's at a duty station location that is where your service member can do their job in their MOS, because we've seen some families say, I want to move home so that my family at home can support me taking care of my children. And that is not something that the military is going to approve. So you need to be realistic when you look at this. It should be by a duty station that can meet your needs, and you are going to need documentation from your providers to prove that your duty station now is not and cannot meet those needs, and that where you're asking for can. So if you need additional help with this, please reach out to us. We have a kind of cheat sheet packet that can walk you through the steps on how to get this done, and we can point you in the right direction of getting everything all pulled together. But it's complicated because it's branch specific.
Yes, so we are coming up close to our ending time. We have an hour for this, so I would like to open it up right now for any closing comments, if anybody would like to add anything or just say anything in general.
Actually, I would love to, just really quick. So some of you might be concerned about reaching out and making a little bit of noise about your situation, whether it's to your legislators or to chain of command or whomever it is. It's all about how you ask. It's all about how you engage. And as long as you're doing things appropriately and in a productive way with, solutions and not just, griping, that's what they're looking for. And I'm sure Heba can attest to that, when we reach out to folks as advocates, we're working for the betterment of the community. I have not received pushback when I reached out and said, hey, did you know, or have you heard of, or did you see this, or, here's the situation. It's usually well received, and, conversations start to transpire about it. Heba, I'm not sure about you, but if you'd like to share about sharing and communicating with legislation as well, and how that works.
Yeah, I'm glad to make this kind of our, the closeout. I'll say thank you for the conversation and discussion. Thanks to all of those all the viewers that are watching, that have contributed either by, sharing questions or comments about their experiences. I'm certainly looking forward to going back and reading through all of those and continuing these conversations. But really, to Sergio's point, I can't foot stomp, reinforce, double down, however many times, reiterate, right, enough, the importance of what he just said, which is, it's all about how we ask. And a lot of these, these issues and challenges and specific, right, specifically EFMP, they're really personal. And you're being asked to share with a complete stranger, right? And many times, whether it's someone that you're working with within the organization, or it's it's someone within the service, branch that you're assigned, whatever, you're being asked to share really personal information. And I understand that that can be incredibly challenging, and can become emotional. But just remember too, if you approach those conversations with, look, this person wants to help me, they just can't know what they don't know. And my goal is to help raise awareness, to educate, and to inform about an experience that I am going through, but to advocate for systems advocacy, right? So that this process changes and can be better for families in the future that come, alongside us and after we do. That's really critical. And I just want to make sure that, I mentioned this here. There is never a situation where your military member should be getting in trouble with leadership or chains of command if you are having a challenge or an issue that you are trying to work through as an individual. You, as an advocate, if you're going to ask for help or to raise awareness or to help educate and inform, you can do that. You can do that. And you have every right to do that, regardless of your, obviously, affiliation with the military. Now, there is a responsible way to do that, obviously, but that is a possibility, and that is an open avenue for discussion and conversation, especially when you have exercised all of the potential pathways that the department has or has not provided you. So working with your legislators and your elected officials is critical. And if processes, systems, policies, programs, and initiatives aren't working the way that they are intended to, that is an appropriate discussion and conversation to have with your legislators. So if you need help doing that, my door and my inbox is always open to you. Thanks again for having me.
Okay, thank you so much for that. That's some really important information. I just want to let all of our viewers know that as we sign off, any questions that weren't answered, we'll get back with you one-on-one. Some people wanted us to reach back out with them from the Google form, and others, if you commented publicly or even DM'd us, we will get back to you one-on-one on those questions. Answers to those questions. And also, I just want to thank everybody for coming today. It means a lot for you to spend your time. I know that you have very busy schedules. And by the way, we're not paying you for this because we're all volunteers. So thank you so much for coming and uplifting the voices of all EFMP families. We feel underrepresented a lot of times, and this it feels good, honestly, to have you hear us, and especially when you go to other places now, you'll be armed with a little bit more information, and we are here always to answer any follow-up questions you may have in regards to EFMP issues. So with that, we'll sign off, and thank you guys for either watching this live or watching it later.